Hey, mom friends! This is Functional Medicine for Moms, where we look at motherhood through the lens of functional medicine. I'm your host, Kelly Moline, a pharmacist with advanced training in functional medicine. From pregnancy and postpartum to everyday parent life, we talk root causes, natural solutions, and real stories from our own family's journey, plus conversations with experts along the way. Hello, welcome to Functional Medicine for Moms. I'm Dr. Kelly Moline, and we have our second interview today. I'm so excited. So I have Dr. Danyell here. Love the name, by the way. That's our baby's name as well. And she is a physical therapist, and I'm going to introduce her, but I'm so excited to have her on our podcast today to talk all about pelvic floor and how physical therapy can really benefit us moms. So Dr. Danyell Russell is a doctor of physical therapy and the owner of Strong Foundation Physical Therapy, where she helps women build strength and confidence through every stage of life. With a fitness-forward approach to pelvic floor and orthopedic care, Danyell focuses on empowering women to reconnect with their bodies during pregnancy, postpartum, and beyond. Her mission is to help women move, lift, and live with freedom and strength. Welcome, Dr. Danyell.
Thank you for having me. I'm so excited to be here.
Yay. Okay, tell us a little bit about yourself. What got you into physical therapy, but more specifically, pelvic floor with pregnancy and postpartum, and why you're here today?
Yeah, awesome. So I have been a PT for 11 years, and originally I was mostly in the orthopedic space. I got into pelvic health because I started having babies, and between my first and second pregnancy, I had started doing CrossFit recreationally. I am not a good CrossFit athlete, but I enjoy doing it. It's fun for me. And so I had been doing CrossFit for about a year when I got pregnant with my second baby. And I'm sure that if any of the viewers have been pregnant, they have seen that there is kind of this like interesting space of like what is okay during pregnancy, what is not as okay during pregnancy. And so I selfishly took some courses specifically for pregnancy and postpartum athleticism, and from there was like, oh well, I really love this population, this is so cool. But then I felt like I needed to take it a step further and actually do pelvic health, and so that was kind of my motivation for getting into pelvic floor PT. And at the same time, this was in March of 2020. That was when I launched my business, which was also coincidentally when we were in the middle of a pandemic. So talk about like a
Yeah.
huge shift. Yeah, like I went from not working for myself to working for myself and also into a new specialty while I was pregnant with our second baby. So it was kind of a crazy year.
Wow.
Yeah, yeah.
Yeah. Yeah. I think the rest of us had a crazy year. That sounds really crazy. And you also do mobile PT,
I
right?
do. I do. And that kind of came about as a way for me to keep costs low for my business at first. And then I was
Mm,
really like, as I got into it and I was seeing a lot more like pregnant and postpartum moms, I was like, wow, like this is a way for me to reduce the barriers for care that moms have in their lives, because it's already hard enough to go and seek out care for pelvic health. I think that there's a lot of reasons for that. But then, especially as a pregnant or postpartum mom or a postpartum mom with older kids, it is almost impossible to get out of the house with a baby and toddlers and or to get childcare. And so I love being mobile for that purpose because it reduces the barriers for women to receive the care that they need to get in that postpartum journey. I also have seen some really cool things that I otherwise wouldn't have seen in the clinic, and help to kind of over overcome some barriers in people's lives that otherwise I wouldn't have seen in the clinic, which is really fun.
Yeah, yeah. See what they look like right in their home space. Can
Yes.
you define the pelvic floor and why it's so important beyond just birth recovery? I know I learned about the pelvic floor through a podcast before I was pregnant, so I knew kind of to look out for some things and start preparing, but I think it's a new thing to so many people.
Right, right. And I actually have my handy dandy pelvis right here. So, the pelvic floor is a set of muscles that live at the bottom of the pelvis. So, it is a sling shaped set of muscles that live in the bottom of the pelvis. This is Penelope, by the way. Um, so she gets to come along with me for a lot of the ride here. So, it's essentially a sling shaped set of muscles that live in the bottom of your pelvis. And of course, it's important during pregnancy and postpartum because those muscles are going through quite a bit of stuff during that time, right? So there's a lot more pressure during pregnancy. And then physically, like if you are giving birth vaginally, the baby is coming through the pelvic floor, or not through it, but it opens up to allow space for baby to exit the body. So obviously during pregnancy and postpartum, that's huge. But just in life, our core includes the pelvic floor. So it we want to make sure that we are keeping the pelvic floor and the core strong and stable because that is the literal foundation from which the rest of our body moves on. And so it provides stability for the rest of the body, but also it helps to hold our pelvic organs. It helps to make sure that stuff stays in the body that we want to stay in the body, if you catch my drift. Um, and then also
Mhm.
relaxes to release those things out of the body whenever it's time to release those out of the body. It helps to move fluid from the pelvic area and the lower extremities back up into the rest of the body. It also helps to with sexual function, which is I think an obvious thing, but it also helps with arousal and desire and lubrication, all of those things during intimacy as well. So it's a huge part of everything that we do. And I think that we give it very little credit for what it does. So,
Mhm. Yeah. And what's happening in those first few weeks postpartum? And what are some safe, simple steps that we can start doing early on if someone is just about to give birth?
yeah. So I think from a birth prep perspective, learning how to relax the pelvic floor and allow it to actually expand and make room for baby to descend into the pelvis and then out of the pelvis is super important. And then if we are
Mhm.
considering like postpartum, the pelvic floor has been through some things, right? So like I think that we should
Mhm.
be treating childbirth like an injury because it really is. Like it's an injury to those muscles
Sure.
in that area, an injury to the skin and the tissues in that area as well. And so I think that we should be thinking of it as like we need to rehab these muscles back to what they were doing before. A lot of times, what can happen is those muscles just kind of go on vacation. They don't really know how to operate after being through the trauma of that injury. And so we have to kind of reteach those muscles on what they're supposed to do. And so some things that I like to give my moms early postpartum is some breathing techniques that help to connect the breath to the pelvic floor and the core to start kind of getting that brain body connection. Some gentle like pelvic floor contractions to again, we're trying to re-engage that brain body connection and reteach the body what it's supposed to do in those instances. Our pelvic floor normally operates on an automatic system. We don't normally have to tell our core and our pelvic floor to do the things, they just do them. But when the body has been through an injury, which childbirth is, whether you are giving birth vaginally or via C section, it's an injury. And those muscles have been through trauma as a result of that. Even if you have the most picture perfect scenario, natural vaginal birth, and very little tearing or anything like that, you're still going through the process of being pregnant and also going through the trauma of childbirth, even if it is not a traumatic experience for you. It's still a trauma to those muscles and to the tissues of that area.
Yeah. Yeah, that's a good point. I know I've heard like when I was pregnant, I was really planning on doing the 5-5-5 rule where you're 5 days in bed, 5 days on the bed, 5 days near the bed. And then my baby ended up in the NICU, so I didn't get to do that at all. And then I've also seen other moms, like get out of the house, go for walks, and they're like, let's move our body. So I guess like what's the right approach? Is there like, depending on the person, is there a happy medium?
So I think that the 5-5-5 rule is great in some ways. I think that the idea of
Okay.
allowing your body to recover is great. I think that most times moms don't actually have the ability to do that. And I think there's a few different reasons why. Like socially, I think that we often do not have the support necessary even if we have a very supportive spouse and we are have a very supportive family and things like that. I think that it's the circumstances surrounding our lives just aren't usually set up to do that. And then from a muscle healing perspective, I think that it's important to know that our body actually needs movement for healing. And so I think that it comes from a very good natured position, the 5-5-5 rule. I just think that there is a little bit of nuance, and I also think that there is some individual preference and also individual needs that need to be met. Obviously, with your case, you didn't have the opportunity to do that because you had to be at the NICU with your baby. I think that oftentimes with moms
Mhm.
who have more than one kid, it's almost impossible for us to do that because you have a toddler that is also needing you. You have maybe a pre-Ker who is going and doing sports or whatever, and you just don't have the ability to do from a social perspective, from a familial perspective, have the opportunity to do that. And I think that also from a tissue healing perspective, we know that just resting is not really how tissues heal. And so gently getting some movement in helps to vascularize those tissues. Getting some gentle, like muscle contractions, helps to reintegrate that brain body connection. And also, it helps our tissues respond to load. Now, what I'm not suggesting is that moms need to run out and go to the gym immediately postpartum. That's not what I'm suggesting. But I do think that some gentle return to activity early is beneficial from a not only from a um, physical perspective, but I work with a lot of female athletes who, from a mental health perspective, they're part of what they do for their mental health is exercise. And so telling a mom who
Mhm.
uses exercise as a way to help with anxiety or depression or insert thing here that she can't exercise for 6 weeks is like that is a devastating blow to those women. And so I strongly encourage early mobility. Again, probably not at the level that they were doing before, but we're getting people moving, and we're starting to integrate some movements that they would do in everyday life. So then we're building that foundation to start getting back into formal exercise over the course of their journey in postpartum.
Yeah, that makes sense. I was kind of told, I think, differently. And what you're saying makes a lot more sense because I was told not to, go on really walks and stuff those first 6 weeks, besides maybe going to the mailbox and back. And after the 6 weeks, I felt like so weak. My core
Yep,
felt so weak. And I felt like I lost all this time that I could
yep.
have been doing more to at least connect and do like that deep breathing and that like core contraction. And now I almost felt like late to the game, if that made sense.
Yeah. Well, and I think that that is a good point that like over the course of pregnancy, even if you are exercising during pregnancy, you are relatively deconditioning. So you are likely not doing the exact same things that you were doing pre-pregnancy from an athletic standpoint. Even myself, who I did
Hmm.
CrossFit all the way through my pregnancy, and I was at the gym on my due date with my second baby doing CrossFit style things, but I wasn't doing the exact same things that I was doing pre pregnancy. And so then, if we're going by the 6 week timeline for return to exercise, and I've already deconditioned for 9 months, and then you're telling me not to do anything for 6 weeks until I get released by my physician to or midwife or insert whoever here to go back to exercise. Then we've also deconditioned for 6 weeks and done essentially nothing. And then we get the go ahead at our 6 week appointment to do whatever without any guidance. And I think that there's just like this lack of education and there's this lack of guidance for new moms on what it should look like for returning back to activity. And I do think that a lot of times moms feel like they are kind of like behind on the game if they haven't worked with a PT before then, because then again, like they're like, I
Hmm.
was told not to do anything. And then all of a sudden I'm being told that I can do whatever, but I don't know how do I get from here to here? And there's not a lot of guidance in the medical world to help with that.
Yeah, I 100% agree. Because those first 6 weeks, I'm like, I don't know what I'm supposed to be doing. I was told to kind of lay low. So, besides going to the NICU, that's what I was trying to do. And then after the 6 weeks and you're cleared, you're like, okay, now what? Because
Yeah.
nothing feels very good. So, I don't exactly know where to go. But I did like do PT for my pelvic floor myself just because I knew that I was doing a lot at the NICU that I didn't really feel comfortable. And then when I would sneeze or cough, I'm like, ooh, that's not how it was pre pregnancy. So let me
Feels right,
figure
right?
that out so that I don't have that continuing. So, what are some of those top signs that someone should see a PT, especially pelvic floor therapy, even months after their birth?
Right. Yeah. So I think that one, leaking of any variety, whether that is whenever you cough, sneeze, laugh, if you are peeing your pants at any stage of the game, that is not normal. It's common, and it is something that often women deal with, not just immediately postpartum, but can even be like years and years down the road. Um, so leaking,
Hmm.
heaviness, um, anything that is like a bulge type sensation, pain in the lower back, pain in the hips, that all of those are signs that your body is not really engaging those muscles the way that we want them to. Also, like the gapping between the abdominals and not feeling abdominal work in the abdominal
Mm.
muscles is another huge sign that pelvic floor PT may be a good option for you.
Is that the diastasis recti? Is that what we're talking about?
Mhm. Yes, yes. And I think
Or
that
is
it's
that different?
important. No, the yeah, it's the same thing. Yeah. And I think it's important to note
Okay.
that there's nothing that we can do necessarily in pregnancy that helps us prevent diastasis. I think that there's a lot of
Mhm.
noise on social media, especially about diastasis and about diastasis prevention, and that like doing certain things can make your diastasis worse. And there's a lot of noise about that. And I think that because there's so much misinformation about it, I think that we're scaring moms away from exercise and during pregnancy and even into postpartum. And so I think that it is one, it's scaring people away from exercise, which we never want to do. We always want to encourage women to be active. And we also know that the biggest thing that we are doing that actually contributes to diastasis and that ab separation is by not strengthening those muscles. And so this idea that like strengthening your muscles in pregnancy leads to diastasis is one, like it's not true. There's no evidence to support that. And also it is actually the opposite. By scaring people away from exercise, we are more making it more prevalent and people are having more symptoms related to diastasis. Are there things that we should maybe modify abdominal wise during pregnancy? Sure. And it's kind of on a person by person basis. It's not a one size fits all, but I think that we also have to stop telling people to not exercise their abdominals during pregnancy because it is scaring women away from getting stronger during pregnancy.
Yeah.
And then it is making it more likely for us to have pelvic floor issues, issues with our lower backs, the more pronounced separation in our abdominal muscles, um, because we are scaring people away from doing exercise during pregnancy.
So, how long does the recovery typically last for the diastasis, for the pelvic floor, all of that? And what does a typical timeline might look like?
Yeah. So, and this is very highly dependent person to person. I tell
Mhm.
my moms, especially my moms who are very athletic and who really want to perform at a high level, that we should expect that 9 months to a year is when we will feel kind of like we have our body back to what it was pre-pregnancy. And does that mean that we can't do things before 9 months to a year? Absolutely not. We're constantly moving towards that optimal function. But I think that for like when we're thinking about like hitting the same kind of like lifting numbers that we were prior, or like running distances or hitting personal records and things like that, I think that it's really important to note that that takes time. And 9 months to a year is the general timeline that I give on that. Everybody's different. And I think that it is that some people are quicker to get back to all of those things than others. But a good general timeline, in my opinion, is 9 months to a year for your body to feel like it is back to what it was before. I would say that like getting back to like impact style activities and like lifting heavy things and working on like returning to running and things like that. Generally, I say like we're working on building that foundation, and for the first 6 to 8 weeks, we are really focusing on making sure that we are moving with intention and that we are really focusing on building that foundation of the core, the pelvic floor, to make sure that we are really honing in on that strength. And then from there, we start adding in some like pre-impact style stuff where we're moving a little bit more with a little bit more speed or a little bit more weight or things like that. And then generally I like to do a return to impact style screen around 12 weeks postpartum, depending on the person. And this is all individual dependent, but generally speaking, like that first 6 to 8 weeks, we're focusing more on intentional movement, and then we start building intensity through increasing weight, increasing speed, that sort of thing. Does that make sense?
Yeah. Yeah, it does. Um, that it's funny you say all that because that's also what I was meant when I went to PT myself. In my head, for whatever reason, so I researched a lot during birth, or I'm sorry, during pregnancy about pregnancy and birth and all this. And I knew postpartum was just going to be its own thing that I didn't know what to expect. But for some reason, I expected to feel pretty good by 6 weeks and pretty much normal by 12 because that's when a lot of women like go back to work. So I figured that that's how the body works. And that is not how the body works. And I'm about 9 months postpartum now, and so to hear that you're saying like it takes 9 months to a year to really feel like you're in your body again and to have that back is, I think, more validating, and that like nothing is wrong. It just takes time. And then breastfeeding as well, pretty much
Mhm.
exclusively breastfeeding. I pump when I do have to go into work, but how does like breastfeeding, hormones, nutrition, stress, how does all of that affect the pelvic floor healing too?
Ooh, that is so good. It all impacts it. So it is almost never one thing that is impacting our healing, right? So especially lack of sleep when and we know that moms are not often getting good sleep, at least not quantity wise. Sometimes we can improve the quality, but quantity wise, we're usually not getting great amount of sleep at this point, or at the early stages. And so then also breastfeeding is keeping us in that hormonal shift of like it our body's no longer pregnant, but it is still producing nutrients for another human. So our nutrition needs to be really good, not only for your milk supply, but also because you are healing yourself. And if we are also adding to that exercise on top of you are healing from an injury, because you are, and then you're also breastfeeding and you're supplying nutrients for another human, our nutrition is so important. And so those two things, and then stress, especially like the fear of not knowing things and not being informed about what's happening in like what's going on with this tiny human that I'm learning all of these new things about, what's going on with my own body. I mean, and then of course, like what's going on in the world, which is a whole other thing. Our bodies are often in a state of stress a lot of the time. And so helping to like regulate our nervous system as well as trying to get as good a quality sleep as we can, as well as trying to get all the nutrients. And then it's like oftentimes it's like the cycle of like there's so many stressors because we are trying to do all of the right things. And but like what is the
Mhm.
right thing? And so I think that that is often like some of the things that I try to help people navigate from a recovery standpoint is like we need to pick those low hanging fruits as much as we can and work on the things that we can actually make changes on and make them make feasible changes on versus it being like, oh, you have to do 45 minutes worth of exercise every day. That most of the time that's not going to happen. Like that's just that's not a feasible option for most moms. And so I am trying to make it where it's easy to incorporate into your life. So then one, it gets done because I'm not helping you if I can't make it something that is easy for you to incorporate into your life. And so I think that that is another huge part of it as well is like trying to the, moms don't moms don't need more things to do. They need you to help them incorporate those things into their life. So,
Perfect. So that kind of gives me another question. What are three simple things that every mom can do at home to support their pelvic floor and no equipment needed?
yeah, so I love that. One is diaphragmatic breathing. I think that everyone should, I talk about diaphragmatic breathing with every single person that I work with, male or female, whether I'm seeing you for your pelvic floor or whether I'm seeing you for your shoulder. Diaphragmatic breathing is so important because it one, it helps with regulating our nervous system. By diaphragmatic breathing, it helps to stimulate the vagus nerve, which helps to move us from our sympathetic nervous system into our parasympathetic nervous system, and everybody can benefit from that. The other part of that is it also, because of how the diaphragm and the pelvic floor mirror each other, when we diaphragmatic breathe, it also helps to move the pelvic floor in a way that is going to um, it's going to move it through the full range of motion that it goes through. So that is also helpful because it is connected to those things. So then we know that as we're doing that, we're also making changes to the pelvic floor. So diaphragmatic breathing is one. Habit stacking. So finding those things that you are already doing in your life. You're already breastfeeding, or you're already making a bottle, or you're already making your coffee, and then tying that to a rehab thing. So whether it is working on some single leg balance, or working on doing a couple of body weight squats, or whatever it is that you need to work on from a strength stability perspective, and tie that with that, you're already doing it. So why not stack your that habit with another habit? I think that that is another great way to incorporate it into your life versus it being like something that you have to like go out of your way to do. And then no equipment needed. I love using kids as the weight and exercise. So I
Yes.
think like doing functional movements like hip hinging and squatting, even like pressing, those are things that you can do with your kids. And one, it is incorporating it into your life. And so then, and also the kids are having a good time. And so I think that that is another great way of incorporating things into your life, zero exercise equipment, and the kids are also involved, so then they are having a good time too. So I think that
Yeah.
that's great. So
No, I love all of those things, those tips. I work out with my baby sometimes because I'm also like, well, as she grows, I'm just going to get stronger. So if I keep her in the
yes,
loop, then I'm
exactly.
just going to get stronger. My weight gets heavier.
Yes, yes, absolutely.
Okay. Just a few questions left. So kind of going on top of the last question, what are some common myths that you hear, like just do Kegels, that's all you need to do?
Well, that's a big one. And so let's talk about Kegels for a second because I think that it's important to talk about. One, I don't think that Kegels are evil. I think that there is a time and a place that we need to work on strengthening the pelvic floor. I think that if we are only ever doing Kegels, we are missing the mark. And so, one, if a pelvic floor
Mm,
PT is only ever giving you Kegels, or if you're OBGYN or midwife or whatever is telling you only ever do Kegels, that's the wrong move. That's not really how our pelvic floor is meant to work. And so we need to be able to selectively use the pelvic floor muscles. But if we aren't tying it to actual function of the rest of our body, then we're missing the mark. And so I think that that's important to note as well, is that one, it's by doing only Kegels, we aren't tying it to function, which means that we're not actually getting back to doing the things that we want to be able to do. We also don't want to have to selectively tell our pelvic floor muscles to do the thing every time that we want them to do the thing. It if we, for instance, like if you are a runner and you leak with running, if I told you to do a Kegel every time that you were running, then you would not get very far because the coordination of trying to control your pelvic floor and also run and also maybe push a stroller and also like there's just too many moving parts. And so trying to re-automize that system is super important. And so I think that there is a time and a place to do Kegels and to do pelvic floor strengthening from that perspective. But I also think that if we are only ever doing that, we are missing the mark. So that is kind of my take on Kegels. Another one is that, and we've already kind of talked about this, but that you can do something to prevent a diastasis, or that doing exercise is going to make a diastasis worse. There is really no evidence to support that you doing abdominal exercise during pregnancy is going to make that worse. Um, it it can is doing some kinds of abdominal exercises during pregnancy or an early postpartum that aren't recruiting the muscles that we are actually intended to do. I think that sometimes that can create bad habits. But it is not going to make your diastasis worse, and it is not ruining your pelvic floor. It is not going to make it where you can't ever do insert activity again in the future. And so I think that that is a big one that I want to put to rest, because doing strengthening exercises for your abdominals is important at all stages. And maybe that looks a little bit different during pregnancy and early postpartum, but we also need to be able to get back to doing our abdominal work as well, and what it looked like before as well. And so bridging the gap there, I think, is really important. Um, did you say two or three?
Wait,
Or
that's so interesting because what was that?
I think I was like, did I have another myth that I was supposed to say? Or but go ahead and finish your.
The diastasis stuff. So I know like during pregnancy, it seems like we're avoiding a lot of core work all of a
Mhm.
sudden, and we're just like stopping that during pregnancy. And then during postpartum, it's like if you have diastasis recti, then you don't do this exercise, or they make like a big modification for it.
Yeah.
So are you saying that we don't necessarily need to stop a lot of them, or just like modifications are still appropriate but differently?
I think that it is individualized for each person. And I also think that, so I have seen moms who have been able to do most every the type of abdominal exercise throughout pregnancy without coning, doming, that sort of thing, and able to keep a really good tension along their midline. And I have also seen moms who have to start modifying early in pregnancy because their deep core stabilizers just couldn't sustain that kind of activity. So what I am saying is that modification can be helpful, but just flat out ignoring your abdominal muscles during pregnancy and early postpartum is quite possibly the worst thing that we could do. Because we know that strengthening those muscles in ways that make sense for maybe stage of pregnancy, your own particular body, is really helpful, and that can help to reduce the impact of a diastasis. We can't avoid a diastasis. 100% of women have a diastasis at the end of pregnancy. It is a normal anatomical variance because we are making room for baby, and it is normal to have a diastasis at the end of pregnancy. Um, but we can reduce the impact of that diastasis on our ability to be able to function by doing strengthening things for our abdominal muscles. And do they always look exactly like what we were doing pre-pregnancy? No, but I think that a lot of times we can be doing a lot of the things that we were doing pre-pregnancy. And because of this social thing that has happened where we have demonized abdominal work during pregnancy, we have scared women away from doing a lot of things that are actually helpful during pregnancy. One of the ones is planks. Like I
Okay.
hear all the time that
Yeah.
planks are awful for your diastasis. And I'm like, that is literally like one of the things that I start working on with all of my moms. Now, we might modify the plank, because it may not be a full plank in a push-up position may not be appropriate for every single person at every single stage of pregnancy and postpartum. But we learning how to control your midline in a plank position is a really great way to work your abdominal muscles during pregnancy and early postpartum. We just may have to find the modification that works specifically for you and your body in those stages. But there are a million different ways to modify that, and I think that we should be helping women modify exercise in an appropriate manner versus saying, "Oh, don't do that because it's going to hurt your core or your pelvic floor," because that is then scaring people away from exercise.
Yeah. Yeah, that makes a lot of sense. So it sounds like for the most part, we can continue doing what we're doing. Um, and then when you see that coning or doming, that's when to start modifying. Is that kind of what you're saying?
Generally speaking, yeah. So coning and doming are signs that your body is not managing that pressure well. And so that is a sign that either your inner unit of your abdominal muscles are not doing the job that they're supposed to, or that the pressure that is in your core canister is exceeding the amount that your body is able to hold up against in that time.
Okay. So I do a lot of gut health with my patients. So what's your take on gut and pelvic floor connection, especially with like bloating or constipation or pressure? How does that affect the pelvic floor?
Yeah, I think that the gut is so important. I think that managing what's happening in the gut directly impacts the pelvic floor because, again, constipation, bloating, the opposite, diarrhea, straining to go to the bathroom. If that's happening, you are absolutely impacting what's happening at the pelvic floor because that is the exit point. Sorry, there was a bug that flew through my house, and I was like, "Whoa!" So that is the exit point for going to the bathroom. And so, if we are constipated, especially chronically constipated, that is putting a ton of pressure on our pelvic floor and can cause pelvic floor issues in the long run. Uh, Obviously, like hemorrhoids are one that come to mind, but also if we are putting a lot of pressure, we can exacerbate symptoms of like prolapse, also pelvic tension, and all the things that kind of go along with that, and difficulty going to the bathroom. So, from a pelvic floor standpoint, those are things that I help to manage from that perspective. But I think that also having like approaching it from like a gut health perspective is super important as well. And so that's also why I love working with people like you who approach it from the internal perspective. So then I can, from an internal gut perspective. So then from an outward perspective, I can help my clients in that, in from a pelvic health perspective.
Yeah. Yeah. Okay. See, gut health is everywhere, guys.
Everywhere.
It affects everything. Okay, we'll kind of wrap up. So, what's one piece of advice you'd give a mom who is maybe the 6 to 12 months postpartum and they feel disconnected from their body?
I mean, uh, shameless plug, but see a pelvic floor PT. I think that going and seeing the pelvic floor PT, if you aren't feeling like you are connected to your body, that is the very best way to reconnect to your body, is going and seeing somebody to help you reconnect to your body. Because we are going to be able to help you to get the core muscles to do what they're supposed to do, get your pelvic floor doing what it's supposed to do, and help you feel more strong and confident in your body. So then everything else is easier. That is a wasp. Okay. Hi. Hello. I have
Oh,
a wasp right here next to me. So he'll just be my little buddy for the next minute or two. See? I don't even have like a shield or
okay.
anything over here to get him. Ah, sorry.
The stress right now.
Yeah. Hmm.
Okay, and I think kind of what we've talked about is like what is common versus normal. So we hear a lot of this normalized by women saying, "Oh yeah, you just like pee a little bit. That means you had a baby," or whatever the symptom is, and
Yep.
that doesn't have to be your life.
Nope.
And there's a lot you can do.
Yes, absolutely. Yes. And I think that like that the denormalization of common things that aren't normal, I think is so important. And I tell people all the time that just because your mom experienced it or your sister experienced it or your grandma experienced it, best friend experience, like that doesn't mean that it's normal. It just means that it's common
Yeah.
and that there are absolutely things that we can do to help get rid of those symptoms. So,
Yeah. Yep. That's kind of what why I wanted to start this podcast too, is because like I'm doing so much research. I know a lot of people
sorry, go for it.
out there want to know more.
Yes. Sorry.
You lost the wasp?
He's no longer in my window, so that's cool.
Okay.
He's not on me.
But yeah, just like Uh, yeah, so just like trying to get more information out there that there is more we can do as moms, and so that we can feel the best to raise our children, to support our families, but then feel the best ourselves too.
Yes, absolutely. 100% agree.
So, Dr. Danielle, where can listeners find you?
So you can find me at Instagram. My handle is strong foundation PTTX. And then I also have a website. It is the same strongfoundationpttx.com. So I post all the time
Beautiful.
about pelvic health, orthopedics, fitness, and helping to make people feel more strong and confident in their bodies. So,
Yes. Yeah. I was seeing some of your posts and I'm like, wait, she has a lot of information out there. So I strongly encourage any mom to follow her, whether you're expecting or you're a mom right now. I think she has a lot of great information.
thank you so much.
Okay. Well, thank you so much for joining me on this and helping all the other moms out there. And we'll see you next time, y'all.
Yeah. Thank you so much.
Thanks so much for listening to my podcast, Functional Medicine for Moms. If you enjoyed today's episode, make sure to subscribe so you never miss one, leave a quick 5-star review, and share it with your mom friends who love it too. I'm Kelly with a background as a pharmacist and training in functional medicine. I help women move past fatigue, brain fog, gut issues, and hormone struggles so they can thrive in everyday life or prepare for a healthy pregnancy. Through lab testing, personalized supplements, and functional medicine coaching, I help you feel better, faster, naturally. Want to connect more? Head over to molinmethod.com or come hang out with me on Instagram and YouTube at Functional Medicine for Moms. On my site, you can order professional grade supplements at my discount or book a free discovery call if you'd like to see how we can work together on your health. This podcast is for educational purposes only and not medical advice. Always talk to your provider before making changes to your health plan. And remember, healthy moms raise healthy families. Catch you next time. New episodes released every Wednesday.